One of the most common questions which is usually asked is that what is the clinical difference between Turner syndrome and Noonan syndrome? Now, on the face value, it seems like Noonan syndrome and Turner syndrome have got a lot of similarities to the extent that some people call that Noonan syndrome is the male counterpart of Turner syndrome. But in order to differentiate between the two, we have to do genetic testing as well as chromosomal testing. Why? Because Turner syndrome is a chromosomal disorder in which there are 45 chromosomes. So it's the 45XO in which the other X is missing. So it occurs in females. Noonan syndrome, on the other hand, is not a chromosomal disorder. It's basically a genetic disorder in which there is problem with the PTPN gene. So how do we clinical differentiate? Number one, Turner syndrome always and always occurs in females. The phenotype would always be female. Noonan syndrome, on the other hand, can occur in males as well as females. Now, coming down to one of the major clinical differences between Turner and syndrome is the intellect. Turner syndrome girls have got normal intelligence, so they have got normal intelligence IQ levels, and though they might have short stature, but in terms of their intellectual capabilities, they are quite equal to their normal peers. Noonan syndrome, on the other hand, these kids, whether they are males or females, they have got varying degrees of intellectual impairment. It might also be associated with some form of mild to moderate global developmental delay. Now, because Turner syndrome occurs only in females, what happens is when they are reach the teenage age group, they usually have lack of menstruation, so their cycles they don't start. While in case of Noonan syndrome, if they are girls and they reach the teenage age group, they do have menstruation. Another important clinical difference between Noonan syndrome and Turner syndrome is the type of cardiac defects that occur in these groups of patients. Now, remember, cardiac defects are quite common whether it's Noonan syndrome or whether it's Turner syndrome. Turner syndrome, by and large, they have got left-sided heart problem. So either they have got coarctation of aorta, or they might have got a bicuspid aortic valve in which there are two valves in the aorta instead of the normal three. On the other hand, Noonan syndrome kids, 70 to 80% of them, they have got right-sided heart lesions. And the most common heart lesion in Noonan syndrome is pulmonary valve stenosis. They can also have a hypertrophic obstructive cardiomyopathy in which there is septal hypertrophy of the heart. As far as other clinical differences are concerned, if you look at the chest, now obviously there are widely spaced nipples in both of them, but in case of Noonan syndrome, these kids have got shield chest, so they might have what we call as pectus excaginatum, in which what we call as a pigeon chest, in which the chest wall is deformed and is protruding forward, or it might be associated with pectus cavus, in which it feels like that the chest wall is depressing inward. If ultrasound is done, abdominal ultrasound, and because the incidence of renal problems is high in both Noonan as well as Turner, one of the most common renal anomalies in kids with Turner syndrome is that they might have a horseshoe kidney, where the kidney is like in the shape of a horseshoe inverted. While in case of Noonan syndrome, if they've got any renal anomalies, these are usually large extrarenal calyces. So these are some of the clinical differences between Noonan syndrome and Turner syndrome, on which you can think that this child might be having Noonan or might be having Turner syndrome. But again, the confirmation comes through chromosomal test, in which the Turner syndrome would show 45XO, while the Noonan syndrome would have either 46XX or 46XY. So the chromosomal analysis is normal in case of in case of Noonan syndrome. But if you do the genetic analysis, they would have problems with their PTPN genes. So this was a very short nugget on clinical differences between Turner syndrome and Noonan syndrome. Have a very good day. Bye bye.